Hello.
Number one, two, three. Number four. How about that? There's where we go. Here we go. Where am I? Oh. 1, 2, 3, 4. 2, 3, 4. There we go. Bang, bang, bang. But
2 2 2 1 2. It's really low. 2 2. Two two two.
good morning. Good morning. This is the Forum from Stewart, Florida. WSTU 1450 on your radio dial. My voice is gravelly. Excuse me. I have today with me a guest friend of mine. I haven't seen you in a while. It's been a while. See,
Good
they all
morning.
come back to roost.
Uh-huh.
Everybody comes back to Florida.
That's right. The
Karen
Sunshine
McCarthy,
State.
who is all right, what's the title now? Business Development
Director
Director.
at Life Care Center of Port St. Lucie.
And that's on Jennings Road, right up the street from the Holiday Inn.
Yes.
And we have a momentous event there tomorrow. Not tomorrow.
Next week.
Next Wednesday. I'm sorry.
Next Wednesday on the 11th, we are be doing the senior networking breakfast that you've been doing for many years, Pat.
Right.
We'll be hosting it at Life Care. It's at 8:30 in the morning, and we'd ask people to come on and join us for a nice event of networking and meeting other healthcare professionals.
Well, to me, everything we do in life is marketing.
True.
And there's either negative marketing or positive marketing. When a staff member complains about something, that's negative marketing.
Right.
People hear that.
Mm-hmm. Absolutely.
And obviously, I like to read things that have data in them, not just speculation. That's why I don't read the newspapers anymore. I like the data. I like the real thing. They say that when you like a business or something, you will tell 3 people.
Mm-hmm.
When you don't like something, you'll tell up to 20.
Oh, absolutely.
Don't shop there because, they do to you. They
Yeah.
do this, they do that. They're bad.
Mhm.
Tell everybody kind of thing.
Absolutely. Yeah, we're more often to speak negatively about something than we are positive. Just in doing marketing research and stuff through the years.
And
That's a very true statement.
And you have to flatter your staff somehow to make them feel like this is more than a job. When I first went into marketing at the nursing home I worked at, and no, I was not a resident there. I was a worker there. And it came time for Christmas, and I was ordering some things, and I wanted calendars. So I ordered an extra 100 calendars. And somebody said to me, "Why'd you order extra 100 calendars?" I said, "Because there we have 100 staff. I don't want to give something on the outside to someone
Mhm.
and then neglect." Somebody said, "Oh, the pen. Oh, no, you can't use that pen. We're going to give that away at the health fair."
Mhm.
No, that's wrong.
Right.
Make your family, your working family, feel like they are a cohesive family.
Right. And appreciated. Always. Always. It's number one. One of the sayings that we have at Life Care is whatever it takes and then some. So, and that also applies to the employees and our guests that come in to visit us, that we would go above and beyond. And that's
I
especially
got
for
one for you.
employees.
You
Yeah.
want to do something locally?
Uh-huh.
I love this. I had a CODA, certified occupational therapy aide. Used to wear a white jacket when she did her stuff. And I noticed one time she went up to a CNA and reached in her pocket and handed this lady something. And the lady hugged her. "Wow, thank you so much." So I waited till they kind of walked away, and I went up to my staff member and I said, "What'd you give her?" She said, "Well, let me show you." She pulled out, she had a little disc, a little cardboard disc that she had cut out. And on it said, "You just got caught doing something right."
And that makes a big
How
impact.
many times do we say to a staff member, "You did something right"?
Yeah. Right.
No.
Doesn't
See a
it?
lady coming out of her room, hair is all combed nice, her clothes are color coordinated. She got a little lipstick on. We don't go up and say, "She looks great. Thank you so much for what you did today." Put her in the corner. I mean, we're missing
Mhm.
that reinforcement. The number one motivator in this country is not money. It's recognition of a job well done.
Absolutely. Absolutely. I agree with that. It's very important in any business to recognize your employees. They're the ones who create your success. So, what we do is a nice thing. My partner that I work with, Rena, who's been with Life Care for many, many, many years, she has a raffle about once a month for employees. And it's just she does it on her own, just because she appreciates the help and the assistance that people give her. And she'll get a cute little, item, and then she'll put gas cards or things like that, and she'll do a raffle, 4 or 5 people,
Nice.
and just out of the kindness of her heart,
Nice.
in appreciation for the employees that work with us. And she's been doing that for many years, and everybody appreciates her. And it goes a long way telling somebody that you've done a very good job, or things look great.
Or once in a while, bring a lunch in
Uh-huh.
for a shift.
Mm-hmm.
Show up at 3:00 in the morning with a pizza.
Mm-hmm.
But the 11 to 7 shift is largely ignored.
Yeah. Absolutely. You never see them.
And then they're
Yeah.
not, well, they have jobs to do. I know they're very busy.
Very
It's not that
busy.
they're not doing things.
Mm-hmm.
They're washing wheelchairs. They're doing all kinds of stuff. But once in a while, that's
Just pop in with a pizza or some candy or something like that.
something.
Mm-hmm. Yeah. And it doesn't have to be.
And they're shocked.
giant.
Like, what are you
Mhm.
doing here?
Right.
Like,
Yeah.
come to see you.
Mhm. Yeah. And that's one of the nice things with the company that I work for. They do have a lot of things that they do and appreciate the staff quite often. We have recognition programs, and then quietly, a lot of the department heads and things do things on their own to appreciate their staff, as well as our company does a lot of things to appreciate the staff. And it's important. It's very
That's been
important
the
because
same
we're in the
company.
business of taking care of people.
Hasn't it been the same company since the inception of the program?
Absolutely.
Yeah,
Mhm.
I went to their opening.
Mhm. It's about 20 years.
It was like a religious ceremony. They had a woman singing Bible songs, or
Oh, really?
and piano or organ and stuff, and there was a very somber tone and the lectures and stuff. I thought, this is nice,
Hmm.
very soothing.
Yeah.
It wasn't like, "Oh, look what we done here," kind
Yeah.
of thing,
And it's a beautiful campus.
Yeah, it is.
It really is. We have a sister facility that's on our campus, which is Harbor Place, which is an independent and assisted living. And then Life Care itself is skilled nursing and rehab.
Mhm.
So it's a beautiful place. And, take pride in what we do over there. We really enjoy.
What else do you offer with the assisted living? Is there a memory care
There's a
component.
memory care as well.
Okay.
And
So you can go through the whole gamut from
exactly.
independent to
Mhm.
nursing home if
Yeah. If
is
it's
your
needed. Absolutely.
task, right?
Mhm. Absolutely. And then we provide skilled nursing and rehab as well as long-term care. At Life Care, we have 117 beds in the facility. We try to strive for a home-like environment. We want to make people feel as comfortable as possible. Um, we have entertainment, we have activities, we have outings, things like that. We try to do as much as we can to keep people feeling like they're in a comfortable home like environment because it has become their home.
Plus, you offer outpatient.
We
care.
do outpatient rehab as well. We have a fantastic rehab to home program.
Well, it makes sense if you've been working with a particular physical therapist, let's say, and then you've been discharged to the home, but the doctor's written, a script for more therapy. It makes sense to go back to the same person
Absolutely,
rather
yeah.
than have somebody start all
Mhm.
over again with a plan.
Mm-hmm. Well, the continuity of
Yeah,
care.
of
I mean, and
course,
that's what's important is to have that continuity of care, to have everybody all on the same page, and making sure that we're all striving for the same goals, and that's including the family. It's including the resident itself, the physicians, the therapists. It's an entire team approach to healthcare.
Plus, you need a lot of in-services.
Lots of education.
But the way I look at it, it's like mowing the lawn. The lawn looks kind of cruddy, and you mow it, it looks beautiful. A couple weeks later, you have to mow it again.
Absolutely,
and
yeah.
that's the same thing that happens with in-services.
Yep.
We do these things, we get people all psyched up. A few weeks later, we start acquiescing back to the old stuff. Then you have to do that boost again with another in-service. And that's nothing wrong with that.
Right. And as you know, healthcare changes. It's the only constant in healthcare, pretty much.
That's right.
And so you're always updating, you're always educating the staff. We have physicians that come in that assist us in education of the staff on the most latest inventive things that are going on. We have a great company that provides us with the information and the education that's needed to bring the best to our residents in the facility. So it's it's a whole team of
that come in from corporate,
absolutely.
regional.
It's an entire team approach, and it's about the whole person.
Well, sometimes they can work against you. At one point, I was working for a very large nursing home chain. I believe they had at that time 600 nursing homes in the country. I think there were like 50 in Florida. And a marketer came down. I was doing rehab. I was doing marketing and admissions. And he said, well, your census is low. I said, I know that. He said, well, why is your census low? I said, because it's not season. And he looked me in the eye and he said, what season?
Oh, okay. Yeah.
Okay. All right. So we start.
From the beginning.
I had some fun with him too because I said, I can fill this building tomorrow. Fill it right to the rim. He said, how can you do that? I said, I can go in the mall and push old people over.
Oh, Pat.
Fracture their hips. He said, you can't do that. I said, look, I can sell a bed, but I can't manufacture a patient.
Right.
I would show them what they would have if they come here, but I've got to go find them.
But haven't you seen over the years that, the season, there's a lot more people that are staying here.
Yes.
Lots and lots more people. So our seasons have changed a little bit. We talk about the season, the wintertime here is the season where we have all our guests from up north that come to the beautiful Sunshine State. And everything gets real busy. Traffic, of course. Everybody talks about the traffic. But in healthcare, we do get a lot more busy during
and we
this
don't
time
have
of year.
the big swings that other businesses would have in the state of Florida, like a restaurant. Okay, if you can't make your money in the first 6 months, you're going to close your doors.
Right.
But that's not true with the nursing home because those people can't go up north.
Right. So that's like I said, there was
right.
A lot of people are staying now. A lot of people are staying here through season. So we're seeing a constant now, more so than we saw the ups and downs several years ago. So it is changing. I think more people are staying here in Florida all year long.
How about this for another piece of data?
I love data.
The average length of stay in a nursing home in the United States is less than 2.5 years.
less than 2.5 years.
Mhm.
Mhm.
Now, we have people there who've been there 10, 15 years, but there are people who have passed away within a month, within a couple days,
Mhm.
within 6 months of being a resident because they have needs that warrant that level of care.
Mm-hmm. Yeah, absolutely. What I find interesting is I've been doing this for quite some time. So 10, 15, 20 years ago, you had residents that would come to the facility and they were 78, 80, 82. And we were like, wow, that's old. And now with technology and, how the healthcare industry has, evolved, people we have now 90, 100, 103, 107,
Mhm.
99, doing great, having an elective knee or hip in their 90s because they still want to continue to play golf. So with technology and innovation over the years, people are, I think, living longer, healthier, and happier lives.
I hope I get this right. My mother-in-law is 94. My father-in-law is 96.
Uh-huh.
And they live in a condo
Uh-huh. Yeah.
independently.
Yep. And that's what I've
They're getting
seen.
some help from family,
Right,
grocery
right.
shopping and stuff like that. But
Uh-huh.
then they're capable of being in that environment.
Yes.
We didn't
So that's
see that
good for
many of
us,
those.
right?
Yeah, we haven't seen that many of those kinds of people.
Yeah, but we're seeing a lot more now.
Mhm.
Just in the last several years, just to see the the age population of age, and it's increasing year to year with what people can do. And like I said, they're elective, they're having elective knees and things like that in their late 80s and 90s.
Right, right.
Because they still want to play golf or tennis or swim and things like that. So it's actually fantastic. I mean, I think it's good news for us moving forward. The next generation that's coming through with healthcare technology and the innovative things that are happening.
The only thing we have to be very careful of, and there was a little scare when Obamacare came out because apparently there was a manual written in, there was a whole section on orthopedics.
Uh-huh.
And apparently the story was, I'm not sure it was true or not, a group of surgeons went to Washington and pulled the act out and started reading, and it looked like after 90 years old, you would give palliative care.
After 90. Yeah, well, that needs to be rewritten.
Exactly.
That should definitely be rewritten.
They were up in arms saying there was somebody found it. Now, I don't know if that's true or not, but sometimes you read a bill and there's a bunch of stuff in there that nobody ever talked about.
Uh-huh. Yeah,
Let's
there's
add that
700
in.
pages of something
And then
to
once they
read.
pass it, that's it.
Uh-huh.
I think it was 1,000 pages.
1,000 pages.
Yeah.
Yeah, that's a lot of reading.
Yeah, that's a lot of reading.
It's definitely a lot of reading.
Well, we're in right now kind of like we're sort of in a possible pandemic with an illness.
Uh-huh.
Possible.
Yes.
So far, the United States has done a phenomenal job in curtailing, controlling what's happening. More are coming in. They're getting, but they're grabbing them right away. So far,
right.
Education. You don't wear a mask anymore.
Yeah.
Only if you have the disease.
Right. So we, we've been watching, of course, because of the, the business that we're in. We're definitely monitoring the CDC recommendations. Basic, washing your hands.
And my little note on the email.
Yes. Letting people know that if they have any type of, even in flu season, same thing, same different precautions that we use for flu season, that if you do have a cough or a cold, that you stay home.
Well, I think they just raised the possibility of death with this disease, the coronavirus, to 3.5%.
Oh, okay. I didn't see the
flu was
statistics yet.
around between 2 and 2.5%.
Okay.
But every year a whole bunch of people die from the flu.
Oh yeah,
and
absolutely.
hundreds of thousands of people get the flu
and are hospitalized.
Right.
And we have vaccines. We do have flu vaccines.
Apparently,
too.
they've jumped on something right away that they think is going to be a winner. They've got to put it through the trials.
Right.
And the FDIC or whoever is.
The FTC, right?
Yeah. Have given them early permission to go ahead and do the trials.
To do all the
normally
trials.
It takes a year or two to set that up.
Right. That's important. We have the greatest scientists and physicians in the world. So
been only one case reported in Africa.
Of the coronavirus.
Okay. One case.
Okay.
Why?
I
What
don't
are
know.
they eating down there?
Who knows? I mean,
You would think they don't have the best sanitary conditions. You
a
know,
lot
I
of
mean,
different
of the
countries and
countries, and
stuff like that
they're
don't have the
overcrowded in
right.
cities and stuff.
Mhm.
This would be so easy to transmit this
Mhm.
disease.
Right. Well, with big populations, we have, giant populations in major cities here. And,
True.
um, the numbers right now seem, small, but, we've been just monitoring the news and listening to the recommendations of the local health departments and the state and the federal government as far as being in the healthcare field. Um, Myself, I'm in and out of hospitals. I'm in and out of physicians' offices all the time. I wash my hands all the time, constantly. I'm always washing my hands, but I've been doing that for many years because it's one of the easiest ways to stop any type of spread of virus or infection.
Another study that was done
Okay, here we go with our studies.
was a college campus. They wanted to find out about how to transmit the flu. So they took X number, let's say they took 20 people who had the flu and matched them with 20 controls, 40 people, and put them in a very small room and had them interact with each other. And they videotaped everybody. Then they went to check to who ended up with the flu and went and looked at their films. Half of the non-affected people didn't get the flu. Half of them did. When they looked at the videotapes, the people who didn't get the flu didn't do this.
They didn't touch
Didn't
their
put
face.
hand to their face.
hmm
The others that would scratch their nose or
Mhm.
do this and they got it. So the carrier in that room was the hands.
Was the hands.
And that's, I think, one of the reasons why, because we touch so many things.
We do.
You know,
hmm
I think that was one of the reasons why they were saying wash your hands all the
Yeah.
time.
Right. And it's normal when you meet somebody to shake hands. We've been doing
We can do
elbow bumps now.
Fist bumps.
Fist bumps. Well, fist bumps is still hand
Still
to
hand
hand.
to
So the elbow, I think, is better at this time. Coughing into your elbow.
Right.
Is what they're saying, that you're not coughing into your hands now. And I'm sure, a lot of the stores are probably selling lots and lots of hand sanitizer.
Oh, I'll bet.
And, but they're saying that the whole face mask thing probably isn't going to make a big impact.
Well, they said that the face mask doesn't prevent you from getting the disease. The face mask protects everyone else when you have it, that you're going to cough into a piece of paper or whatever, fabric, instead of coughing into the air.
Into the air. And I believe that it's an airborne illness. The corona
I
is
guess
what they're
so,
saying. Yeah.
And that makes sense
mhm.
that,
Yeah.
that I would wear a mask only if I was infected. Plus, so far, the incubation period doesn't seem to be that bad.
Yeah. Well, I think there's still a lot of unknowns. I think that, they're probably working tirelessly to figure out, how to, stop it and, make it go away. And pretty much is what we, the scientists and the people in the government are trying to figure out right now. But yeah, so there's still so many unknowns, and I think it's just simple, basic, making sure, I'll say it again, wash your hands. Wash your hands,
I
sing
wish we
happy
could-
birthday while you're
Right,
washing
right.
your hands.
I wish we could take this approach to disease.
In general.
Let's
Yeah.
jump on Alzheimer's with the world effort. Let's jump on Parkinson's with the world effort. Let's jump on some of these other disease things that we really need concentration in.
Right. That kill a lot more people than,
Exactly.
the flu or
right.
the coronavirus. Yeah,
Right.
absolutely. Cardiac illnesses, things like that. Early prevention, early health care, preventative medicine, healthy visits.
Preventative medicine
Uh-huh.
costs so little
Exactly.
compared
And
to
it saves money in the long run, is doing the preventative medicine.
true.
Mhm.
True.
Most people only utilize the doctor and stuff is when there's something wrong. But instead of going prior and, finding out and doing some testing and things like that.
It's kind of like when you turn 65. Where do you go? Do you going to go to part A and B, or are you going to go to part C?
Right.
When you have very little health needs, doesn't part C make the bigger difference?
And I believe
Financially?
it's a lot of there's a lot of, different options
Oh,
that
it's like
people
buying
have.
a car. You want the with
Mhm.
sunroof. You want leather seats,
Right.
Because there are all these plans that you have
Right.
to.
You want all the bells and
Yeah,
whistles, or
right,
you
right.
want the basics. So
Right.
I guess it depends on your own healthcare needs. From what I've seen over the years, with the different healthcare plans, it's based on how healthy you are
Right.
and what you would need. Some of the healthcare plans now, have included hearing aids and dental and vision and things like that, and that's a big bonus
But
for a
you
lot
have
of
to
people.
look at the data because they will allow you typically $1,500 one hearing aid for the year.
Hmm.
You can't buy a decent hearing aid for $1,500.
Yeah.
And you may need two.
Right. And
Now-
health insurance, most health insurances do not pay for hearing aids.
Correct.
So, and I think that should change. I think people have the right to
What
hear.
about vision?
Vision is the same.
Why don't
Yeah.
they pay for vision?
How about dental?
And you can-
Dental costs are astronomical for people,
Of course.
and the health insurances associated with dental are
I don't
pretty
have
basic.
I don't have a dental plan. I have I don't have a company that I contract with for dental work. I have a plan, which is a discount plan.
Uh-huh.
I pay so many dollars a year, and if my dentist participates, $130 procedure might cost me $80.
Okay.
That's a
So you have a
discount.
discounted plan.
Yeah, and the more like root canal treatments, dentures, and all that stuff, the rate is even more lucrative
Right.
for the patient.
Excuse me.
And I think it's like $140 a year,
Okay.
$12 a
Yeah.
month, something like that.
So I mean, to
And then,
get those
so
discounts, it's
there are
worth it.
programs
Yeah.
out there like that. It
Yeah.
doesn't necessarily
Mhm.
have to mean you go to a dental company and buy
Right.
a policy.
Mhm. And you can buy it outside of, an employee-based plan. You can still
Exactly.
have it
Yeah,
on the outside,
exactly.
kind of like the discounted drug programs that they have out there as well, for people.
Well, they have each year. Medicare sends out a book, and it's a formulary book, and it has tier 1, 2, and 3 medicines. The more expensive medicines are higher in the number.
Hmm.
A generic might be category 1 instead of a 3. And you might be paying $50 copayment on a type 3 drug.
Right.
And some drugs are not on that list.
Oh yeah.
When you look at psoriatic arthritis,
Hmm.
I'm not sure whether Humira is on that list, Tremfya. There's several of the other drugs. I don't think they're even on the list.
Hmm.
And right now they're charging between $3,000 and $5,000 a shot.
Hmm. Yeah,
that
the cost for prescription drugs is astronomical. What I think is that if I see it on TV, I probably can't afford it.
Very good.
Yeah. So that's another thing that's, difficult for the seniors. You read reports and you see data where, they're balancing money to see if they can afford their insulin or their rent or gas or food. And, that's just sad. I mean, I think that, nobody should be able, should have to, go without, drugs
Well,
like that.
maybe we should make an effort at both ends of the spectrum. Get people to work with the seniors who are financially in trouble,
Mm-hmm.
and get a group of counselors to work with people who are just coming into the workforce,
True.
training them not to end up being like these people over here.
Mm-hmm.
With a little bit of direction. I'll give you an example. My son ended up, his first job was in teaching, and he wasn't making very much money. He was just barely making it on his own. He wanted to do that. And I said, I don't care. You have to start a 401k. It could be $5 a week, $10 a week, but you must do it.
Mm-hmm.
He said, why? I said, later on, you'll realize it.
You realize it when you're 50.
And he'll be 48.
He'll be 48. So I think, what do you have to go to? Yeah.
He's got a great retirement plan.
Oh, so he's got a double then when he's
Thank
ready.
you, Daddy.
Thanks, Dad.
Well, because we're laughing here and Evan's all nice and comfortable in his chair again, we're going to take a little break and come right back.
All right.
And we're back again with this good. Yeah, I saw that on TV last night. Let me be a little more articulate. We are back here with our radio program, The Forum, with Karen McCarthy from Life Care
Of
Health.
Port St. Lucie. Yep.
Life Care Health Center.
Life Care of Port St. Lucie.
Of
I'm pretty,
Port St.
yeah,
Lucie,
Life
okay.
Care Port St. Lucie. On Jennings Road in,
Jennings
in
Road.
Port St. Lucie, not too far.
3700.
I think it's
something like that.
3706, something like that. Not
When
I
you
should
turn
know.
right off of US 1, the Holiday Inn is across the street.
The
and you-
Holiday Inn with the waterfalls.
Right, and you go about halfway up that road. You got to watch it. There's a little entrance, and you pull in that entrance. And the first building on the left is Life Care.
It's 3720 Jennings
3720.
Road. I was able to just look at this right now and get it correct. We're not too far from St. Lucie Medical Center.
Right.
Right around the corner from them. And like we were talking earlier, we're going to be hosting your senior networking event that you've been doing for, gosh, how many years now?
20.
20 years.
Maybe.
Yeah.
Yeah, or at least.
Uh-huh.
Oh, at least 20 years.
It's a monthly event that you have. Different places sponsor it every month. Life Care has been sponsoring it for many years.
We have 12 different locations. I've got
mhm.
about 6 on the list.
Waiting
for somebody to drop out.
Waiting
If I
for
come
some-
to you and say, you want to keep your month.
Yes.
Well, why? Oh, I know why. You want people to come in the building.
Mhm.
You want them to be able to take tours. You want to have them leave
Mhm.
an impression.
Exactly.
And that's worth a
Right.
breakfast, by the way.
And then it is worth the breakfast. It also is nice for the the medical professionals that are in the community to get together monthly.
And it's marketing.
Uh-huh.
That, you know,
Talking, seeing how things are going, talking about the different trends that are going on. What we usually generally get anywhere between, 50, 60,
Yeah, right, yeah,
65 people,
yeah,
just
yeah.
depending on the time of year. And of course, holidays, we get a little less. But it's been a great thing for 20 years, Pat. It's been an
Well, we've-
awesome network that you put together for
think we're
us. We
coming up
appreciate you.
our 4th year in Vero right now.
hmm
We end up with 15, 20, 25 people. To come up to
Okay.
that.
So
We're
I
building that one
mhm.
up too.
that'll grow as well.
Mhm.
And the senior networking here is Martin and St. Lucie County. You include places.
The only
in
the only outside of this immediate area is Linmore.
the Linmore and Fort Pierce.
Right.
Mhm.
And then we also, from the south, we have the Discovery.
Assisted living.
Yeah.
Right.
And they're IL too, aren't they? Independent.
I'm not 100% on that, but
Discovery Villages. Is
Yes.
The name of it.
yeah. Have
And
you
then-
seen some of the new assisted livings that have been being built? They're
Well,
amazing.
that one I was at was not Symphony, but the one down on Hope Sound, down on the left. It's brand new.
Yeah, I don't know the name of that one, but
And of course, Allegro changed their name to Addington Place. There's a new AL going up over the Roosevelt Bridge.
Mm-hmm.
Yeah.
Yeah.
The need is there. I mean,
Absolutely.
obviously, they won't build
Mhm.
something.
It's an attractive thing for people, to move to the independent or assisted livings because you have, the community atmosphere. You're not alone. A lot of seniors are alone. A lot of seniors are home by themselves all the time.
Plus,
Oh.
you have great choices. If you want to be where the action is off of US 1, there's
Mhm.
which used to be Horizon Bay, which is Atria now,
Mm-hmm.
across from the hospital,
Right.
Port St. Lucie. You have Palm City.
Yeah. It seems like there's one going up on every corner.
If you want to be secluded, you go to the dunes.
Yeah.
in
That's
Jensen Beach.
spectacular. Yep.
I call that the Wizard of Oz,
The Wizard of Oz.
because when you go up Cedar Street, that's what it is. Go up Cedar Street, it's like black and white. You hit the crest and you see this beautiful building.
I know.
Now it's like Technicolor,
Yeah. It's a great location,
Yeah.
though, isn't it?
Yeah.
It really is Dune-like.
and it's just very quiet and peaceful.
Very quiet and
Got a
peaceful.
beautiful pool,
Mm-hmm.
nice bar when you
Mhm.
walk in the door.
It's resort style
yeah,
living.
yeah, it is.
It really is. Which is great.
Well, walk into Eddington Place.
Mm-hmm.
It looks like a hotel lobby.
I know.
They got that space above the atrium
Mhm.
and everything. It's very comforting and
Yeah.
it's posh. Like
Yeah.
resort.
It is. It's restored. I mean, we're in the Sunshine State. Why not live, when you retire in your elder years, why not live in a resort style environment?
That's right.
Uh-huh.
Of course, there's a financial burden. You have to
Right.
be able to afford that kind of
Mhm.
luxury.
Right.
But
Yeah. And I think it's, there's all different types of pricing, I think there's affordable and then there's all the way to very luxury. I mean, you
but then
have
then there are mom and pop outfits
Mhm.
ALs that will take 6 people,
Mhm.
and then have in a home.
Right.
Some people don't like crowds. They want a small, just like home kind of
Mhm. A
situation.
home-like
Right,
environment,
right.
yeah. And that's what we try to do at Life Care too, is try to provide that home-like environment because people, they don't want to be um in a facility or for a rehab. They want to be at home. So we try to simulate that home-like environment, especially when people are coming just for rehab. They might have had a hospitalization for an illness or surgery and things like that. They're not quite right. They're not quite ready to go straight home. So we have a transitional program to where
Mhm.
we try to get them back to their prior, level where they were before any type of illness or accident.
Well, sometimes you have to figure out things that may initially seem like common sense,
Mm-hmm.
but it's not really common sense. It's professional intuition. Okay. Give you an example. Let's say Millie doesn't go to activities. Every time you invite Millie, I don't want to go. She goes to her room. I don't want to come out of my room. I don't. Well, why don't we take the mountain to Mohammed? Why don't we get the activity director and one of the volunteers from the group to go knock on Millie's door? Say, Millie, can we come in? We designed an activity for you here,
Mm-hmm.
and do an activity in a room.
Yeah,
10 minutes and leave.
absolutely.
I'll bet you after a while, Millie will come out of her room.
Well, and it, and also, I mean, some people are private. Some people their whole life they've
Right.
been private, and
But their kids will say, I want my mother in
and their kids
activities.
and their mother's like,
Mom
no,
just
I
said
don't
she
want
don't
to
want to
go play
go.
bingo.
That's right.
I enjoy watching Dr. Phil. Or The Price is Right. They have their routines.
My wife's grandmother lived to the age of 102. She'd been in Florida 30 some years. Her husband died. They moved her back up north again, put her in it was like a IL.
Uh-huh.
And I think she was like 90 or 91 when they moved her. She was the oldest resident there. I was on the phone with her one night, and I said, "Do you participate in anything there?" She said, "No." I said, "Why?" She said, "They have bingo, and you got to put a piece of corn on a number when the number's called, and when you win, they give you a can of beans."
Oh
She
boy.
said, "Plus, I don't have time because that's when I watch Dallas."
Oh, okay. That was her shows. Yeah. Yeah, they like their
She didn't want to
shows.
come out.
Uh-huh.
Maybe get a
Yeah.
can of beans.
Yeah. Well, you know what? I mean,
Oh, and she said, "These people, they act so old."
they act so old. Yeah.
And she
Don't you
was
love it though?
10 years older than
Uh-huh.
anybody else. Yeah, right.
Don't you love it? I think it's fantastic. What I see also is the technology. I mean, we have residents and people that live with us, and they're on Facebook. They're Googling. Everything is at your hand now, and it's great to see. They FaceTime with family.
I think FaceTime is great.
It's wonderful. You're not missing a thing.
There's a couple of programs that you can use like FaceTime.
Uh-huh.
And you're there and it's live,
Mhm.
and
Yeah.
watch the kids grow up.
Yeah, and we have a room. It's a kind of like a library, and we have internet access and computers there for residents who'd like to come. And there's several residents that'll sit there on the computer all day. They shop, they order Amazon and things like that. So, people's quality of life is so much better nowadays than it was years ago.
Well, here's a good example. This little thingy here.
Your
all right?
tablet,
It is a reader, a Kindle.
okay.
And this is limited in the number of books you can put in this. Guess how many books you can put in this?
How many?
3,000.
Wow. So
And they say when you fill the whatever, they can pull some out and put them in the cloud and give you more space.
and then you can add more. And then the audio books, which is great. So
Yeah.
say that you have a
Well, I
little
can
bit
buy
of
an audio component for
Uh-huh.
this. It used to be that there were certain programs that you could play that had audio
Mhm.
already installed. Now they're charging for the audio,
Oh, okay. Yeah.
which is true with everything.
Right. But if you're vision impaired and you enjoyed
Oh,
reading your
great.
whole life, now you can listen to an audiobook. So, I love technology. I mean, I think it's fantastic. And
Well, it's about time for me to get my audiobook series out again and read Harry Potter again.
oh, you're
Or
going to go through
listen
or
to
listen to the Harry
Harry
Potter. I wonder who's the reader on it.
He got an award for that. He came up with some over 300 voices
Oh, okay.
that he
I
could
don't
slip
know.
into the voices of the characters, and unbelievable.
Yeah.
Jim, somebody,
Mhm.
Jim.
Yeah.
Jim. He didn't work in a gym. His name is Jim. And it was like the movie. I mean, he sounded like the characters in the movies.
Hmm. I remember when my mom retired, she's like, I'm going to read the books that I've always wanted to read and da da da. And this is several years ago. And I was like, well, would you like to listen to them? And she's like, what do you mean? And I said, well, they have audiobooks now. She loved it, absolutely loved it, and knew that she'd never read half the books that,
See? Yeah.
and she really enjoyed listening to the books. It was part
Well,
of her.
I liked when we had that option because sometimes I'd be reading and get a little tired, and I would just click that on and listen, close my eyes and rest my eyes and do that.
And just listen to the
Yeah,
book.
yeah.
Yeah. Well, everything's at our fingertips now.
Well, we have to be careful because as we age, typically, we develop a disease, and it's called hardening of the categories. I don't want an iPhone. Okay. I don't want a reader. I don't.
You just want to engage like we're doing. We're actually speaking face to face to each other today.
Yeah, that kind of
We're
thing.
not texting or
No,
emailing.
Well, one of the neat things about my phone I discovered was if I put your name and phone number in there, I can find you. If I put your address in there as well, there's a little window you click on and it gives me the GPS coordinates and says ready to go.
Mhm. Exactly where I am, right? You could find me.
Yeah, I don't have to go into my GPS system.
Right.
All I have to do is touch the address and it automatically sets me up from my house to that house.
Right. How about using a map? When was the last time you used a
God.
map, Pat?
When I was hunting for a treasure in my backyard when I was about 6.
Yeah.
No, that's right.
Hmm.
Long time
Yeah.
since I've used a map.
I don't even know if my children would even know how to use a map. My kids are in their 20s, so
Let's see.
I wonder if they know how to use a map. I'm going to
Well,
have to
there's
try that
the
experiment.
AAA used to have the little flip
Uh-huh.
things about, and then basically it looks like what we do today with our maps and
With our
texting.
maps, yeah.
Yeah.
And it tells you the exact time you're going to arrive.
But this is
things
real
like that.
time. I mean, it's pulling.
Uh-huh. Yeah. And they know where your car is parked. Do you ever see that come up on your phone? And then it'll tell you, oh, you visited this location before. So, I mean, that's the privacy issues then too.
I
mean,
can start my car inside
with an app.
with an app.
Yes.
Yes, it's the Chrysler app. I can start. I mean, excuse me, it was not the Chrysler app, the Chevy app.
Hmm.
I can start my car. I can.
That would be good if you lived up north in the
but it
wintertime. You
doesn't-
could
it
start the
doesn't
car.
move until you put the key in,
Okay.
but it'll start running.
Yeah. Yeah.
Like if I were
my
up north, I would do that to
Mhm.
warm up the
to
car.
warm up the car.
Right.
So my daughter-in-law does in the morning before she takes the kids to school. She has the app and starts the car and warms it up. And they're up in Ohio, so it's
Yeah,
rather
right,
cold in the
right.
morning for them.
Smart.
Yeah.
Smart.
Yeah. So, I mean, the conveniences of technology is great. I think, though, we've become a little bit impersonal.
Yes.
Like, this is nice what we're doing today. I actually see you and you see me, and we can, have a nice conversation and engage with each other personally. I think that's being lost a little bit.
Oh, big time.
Hmm.
I've
I mean,
seen
people
two
aren't even using,
teenagers at a restaurant sitting across from each other, texting each other.
Yeah. Yeah. Well, we have, if we go out to dinner, my family and I, we have a rule that we leave the phones in the car.
Mm.
So we actually have a conversation and talk to each other. We've been trying to do that for the last few years, which is nice. And I think a lot of people should do that. Put your phones away a little bit and have a conversation.
True.
Yeah.
True.
Yeah.
We just have to be careful not to overindulge anything like that.
Mm-hmm.
That we're spending too much time with too many things.
Mm-hmm.
We need to, lay back a little bit.
Yeah. Yeah. I agree. But if you notice the kids, it's unbelievable. I can't believe, excuse me, I can't believe my, talking about, I have 3 granddaughters, and I can't believe that my daughter-in-law or other, moms hand these children, $8,000, $9,000 phones. Would you ever give a kid that a piece of equipment that
No,
expensive?
and I would
But they
put
do
re-
it all the
I
time.
would put restrictions on that. If I punished a kid and sent him to a room, the first thing I would do is him or her, I would go in and pull the plugs off of the computer,
Mm-hmm.
take the battery out,
Yeah.
and then take any other advantage
Yeah.
thing.
Like taking everything
You're
away from them.
grounded.
They'd be,
Just
yeah.
go to your room.
Yeah.
It'd be a great thing to go to my
Mhm.
room and play on my computer all day.
Yeah.
You know,
Nowadays.
or the phone. Same
Yeah.
thing.
Yeah. Well, kids need to go outside and play.
Time just has warped me.
Mhm.
When I was a kid, we'd go out at 9 o'clock to play. Seemed like we were out there 2 days, and Mom would call us in for lunch. Time was slow. Things
Mhm.
took a time. And now, I look at my watch. It's 8:30 in the morning, and all of a sudden it's 4 o'clock. What happened?
Where was the day?
know,
Where did it
zip
go?
right through.
Yeah. We're very busy in our lives.
I think we have too many things that we take on.
Mm-hmm. Yeah. Yeah. Yeah, definitely. Slower pace is nice too, but I think we're wired that way, especially, when you're working and things like that. You're wired to just keep hustling and, especially with my position, I'm out in the community all the time. For life care. And I'm running all day
I did
long.
that for 4 years, by the way.
Did you really? I've
know-
been doing
I-
it
I
for
know your
like
pain.
I've been doing it for like a long time. I finally took the Fitbit off because I didn't want to
Oh.
know how many steps I was going anymore.
Or how many you needed.
Yeah. And but I mean, it's not a bad place, this area here to drive around,
No,
I like to use Indian River Drive because it's a beautiful.
it's nice and
If I have
quiet
to
these
come from
on
Fort
there, too.
Pierce down to Stewart or vice versa,
You even
it's
do
a
it
beautiful
from,
drive.
Vero.
Yeah. Or you can take ocean, so you have real
Right.
nice
right.
sightseeing up and down.
You just have to. I try not to be in a hurry,
Mhm.
especially driving.
Right.
I just want to take my time. I don't want to. I'm not going to go 30 in a 45, but I'm not going to go 75 in a 45.
No. Yeah.
People are hustling to get up there, and then there's a red light. So the guy
Yeah.
got from behind you to in front of you. All those annex that he did, that was it.
And they didn't get
Yeah.
any further.
No,
Right.
well, maybe
Yeah.
1 or 2 seconds.
There's always one. There's always one person when you're driving. Always. That's in and out, back and forth, trying to rush, and then you
Well-
all get to the red light at the same time.
Unfortunately, Florida has some pretty lax laws about driving. You don't have to stop to make a right-hand turn if you're in the red. You don't have to signal.
Oh yeah, no.
You can make left turns on red. You can go 20, 30 miles past the speed limit and maybe 40 miles if you have a motorcycle. So that we have all these neat opportunities. And those red 8-sided signs say STOP,
Uh-huh.
spin tires on pavement.
Oh, spin tires on
Because
pavement.
people don't use the word stop,
Yeah,
unfortunately.
yeah.
Certain protocols, I remember from taking the test years and years ago, but you have to stop 3 seconds at a stop sign.
Mhm.
If a school bus is facing you, if the median is more than 4 feet wide, you don't have to stop. These little dumb things are in my head,
Mhm.
and I try to observe those.
Right.
And
I try. I have been driving for quite some time, and I can happily say that I haven't had a speeding ticket. So
that was when I was young.
when you were younger, yeah. But yeah, you can't. The Treasure Coast, Martin, St. Lucie, Indian River County. I mean, how lucky are we to live in a place like this?
Yes, we are.
How lucky. It is absolutely beautiful. I happen to be, I think, very lucky. I live on North Hutchison Island, not too far from the
okay.
Navy SEAL Museum.
Oh, very good. Very
Uh-huh.
good.
Have you been up there to
I've
the Navy
been
SEAL?
back and forth to that place for a while.
It's become an incredible place. It's grown over the years. Beautiful place to take the kids and see, the history and the different things
Uh-huh.
at the Navy SEAL Museum. So I'm lucky. My drive is over 2 bridges, so I get to look at the ocean and the water every morning and every evening.
But you do get clogged up a little bit in season over the
Sometimes.
bridges.
Yeah, but we don't complain about
Yeah,
that.
that's good.
Yeah.
That's good.
Yeah, that's the worst part of your day, that you have to sit and wait and look at the water while you're waiting for a boat
Oh,
to pass
darn.
by.
Yeah.
Oh, too bad. And there might be a dolphin that,
Yeah,
goes
whatever.
by. So, yeah. But I love the Treasure Coast, and, the different things that are going on here are
Well,
great.
we're here to stay for a while.
Yeah.
Well, Karen, thank you very much for coming on this program today.
Oh, thanks for having me.
Don't
It's my
forget,
pleasure.
We got those who are going to be next Wednesday at the Senior Networking Breakfast at Life Care Center on Jennings Road. And for those of you who are not going to be there, you're missing a fun time already.
Mhm. And we do ask that if you do have any type of cold symptoms, please stay home.
Right. The email went out saying you have a cough or cold or the flu.
Mm-hmm.
Use your discretion.
Yes, absolutely. Use your discretion.
We should all mask up for anybody who says they got a cold. Everybody put their mask on.
Well, there's definitely hand sanitizer and everything that's going to be available
Right.
for us.
We'll
in the
pretend we're on
area.
a cruise ship. So everywhere you go, they squirt you. And you
They
give
squirt.
you-
Yeah, we'll designate somebody as the
yeah,
as
and
the alcohol.
You get on a ship. You're due for a little cruise.
I'm due for a cruise, definitely.
Just
I
don't
agree.
Don't go to the east. Just stay in this area.
Yeah, just stay around here. Just get on my boat and just float around.
Well, we're winding down, aren't we, Evan? We're getting there. And we have one more minute. Oh, great. Because I just want to remind you to tell your friends about this program on Thursday mornings at 9:00 on WSTU, and it's called The Forum. And we have very interesting guests, don't we, Karen?
We do have very interesting guests.
And I love doing this because I love listening to people
Mhm.
and people's stories and what they do. And we're educating this community. That's
Yeah,
what we're
and
doing.
we appreciate you, Pat, and what you've done through these years with your
all the money
association.
that I've gotten and everything. You kidding?
Well, you know what? If it was about money, Pat, you'd be done.
Yeah, well, I
It's
have
all
an
about
expression.
your soul.
How many dollar bills can you stuff in a casket?
You can't take it with you.
No. Okay, we'll be back next week again on The Forum.